Hi everyone, welcome back, and in this video we're going to talk about how to recognize and treat the symptoms of a nervous breakdown. I hope you guys enjoyed this video, and I look forward to seeing your comments and your opinions down below. Without any further ado, let's get started. So, what is a nervous breakdown exactly? Well, the textbook definition of a nervous breakdown is, it's a nervous or mental breakdown used to describe a period of intense mental distress. During this period, you're unable to function in your everyday life. Now, for me, I can relate to this. I pretty much have nervous breakdowns every day. Going to work, walking the dog, thinking about what I'm going to eat later on in the day. That's also ties in with anxiety and stuff. But I'm not a stranger to nervous breakdowns. That's what I'm trying to say here. Now, this term was once used to refer a wide variety of mental illnesses, including depression, anxiety, and acute stress disorder. Which also makes sense, right? Although nervous breakdown is no longer considered a medical term, it is still used by many to describe intense symptoms of stress and an inability to cope with life's changes. What others see as a mental breakdown may actually be an undiagnosed mental illness, which is also correct. With that being said, there isn't an exact definition for what exactly is a nervous breakdown. It's generally viewed as a period when physical and emotional stress become too overwhelming and intolerable, and it impairs your ability to function properly. Now, let's go through the symptoms of a nervous breakdown. You may experience physical, psychological, and behavioral issues when going through a breakdown. That's normal. I experience that quite a lot too. The signs of a nervous breakdown vary from person to person, which is also true, and the underlying cause can also affect what symptoms you experience. So let's go through the symptoms right now. The most common symptoms of a nervous breakdown are depressive symptoms such as loss of hope and thoughts of suicidal ideation or self-harm, anxiety and high blood pressure, tense muscles, clammy hands, dizziness, upset stomach, and trembling or shaking. That one I deal with on a day-to-day basis. Insomnia, I also deal with on a day-to-day basis. Hallucinations, I haven't dealt with those yet, knock on wood. I don't think I want to deal with those. Extreme mood swings or unexplained outbursts, that can also be, signs of bipolar disorder. Panic attacks, that is also my life. And these include chest pain, detachment from reality and detachment from yourself, extreme fear, and difficulty breathing. That is me on a day-to-day basis, right to the top. Like, it gets very annoying with not being able to breathe and severe chest pain. Can't even sit down a lot for most of the time. Paranoia, such as believing someone is watching you or stalking you. This can also go into erotomania. Flashbacks of a traumatic event, which can suggest undiagnosed PTSD, which is post-traumatic stress disorder. People experiencing a nervous breakdown may also withdraw from family, friends, and coworkers. And the signs of these withdrawals include avoiding social functions and engagements, eating and sleeping poorly, maintaining poor hygiene, calling in sick to work for days or not showing up to work at all, isolating yourself in your home. Also, you have to take into consideration that there's risk factors that can lead to a nervous breakdown. A person may report having a nervous breakdown when stress is too much for them to bear. And the stress can be caused by external influences. Some of these risks can be persistent work issues like toxic workplaces, recent traumatic events such as death in the family or witnessing a traumatic event, serious financial issues which everyone faces at one point or another, a major life change such as a divorce or maybe a new baby coming into the family. Poor sleep and relaxation, that one is a pretty common one too. Personal and family history of anxiety disorders. With anxiety and it being hereditary, that can pretty much say a lot about your nervous breakdowns. And the reason of that is, from my experience, I get anxiety attacks all the time. And I'm convinced a lot of my family members on both sides deal with anxiety too. And I know it's hereditary. Now, if it being a personal issue and being a family issue, like you've had it pretty much all your life, knowing when you're getting an anxiety attack and knowing when you're getting a panic attack can also differentiate knowing when you're going to have a nervous breakdown. because these are 3 different breakdowns, and if it loops into one, that can be pretty bad too. And you have to try and figure out what your risk factors are for these 3 different kinds of breakdowns. It might be the same thing for all 3, it might not be, but it's good to try and, I guess, self-diagnose what gets you in the state of panic. And again, I'm not saying don't talk to a doctor, don't talk to a psychiatrist. You still should do that, talk to counselors too. But try and like find out what the triggers are for these 3, because it could help you too. And the last one is recent injury or illness that makes daily life difficult to manage. So with that, now we're going to go into how to manage your symptoms. There are ways that you can break out of this cycle. The first one is using talk therapy or cognitive behavioral therapy. So, you know, going to a psychiatrist, talking to your doctor, going to a counselor. The next one would be taking prescription medications such as antidepressants, anti-anxiety medication, and these can help you treat the chemical imbalance, but also be careful too, because some of them have some really nasty side effects. So it's always good to talk to your healthcare practitioner first before taking on any new medication. And practicing alternative treatments such as acupuncture, massage therapy, yoga, meditating, breathing exercises, these all help too. And if you're feeling overwhelmed and you know you're on the verge of a breakdown, consider these strategies for managing your symptoms. And it goes back to kind of what I just said. Breathe deeply and count backwards from 10 when you're feeling anxious or stressed. I'll also leave a link in the description box to some breathing exercises that you can do. Next, cut caffeine and alcohol from your diet. Yeah, that's a pretty big one. I'm still working on cutting caffeine from my diet. I cut sugar off. Caffeine, maybe I drink 2 or 3 cups of coffee a day. Before I was drinking 7 cups or more. So I could say, you know, growth. I'm progressing. The next one, develop a sleep schedule and routine. And this will help you sleep well. This could mean taking a warm bath before bed, switching off all your electronic devices, or even reading a book before bed. Get your body relaxed. Know when to see a doctor. It's not uncommon for someone to feel at one time or another unable to cope with life's stresses, right? That's normal. We're all human. You're not dealing with stress in a healthy way if you're having difficulty doing your daily tasks. A nervous breakdown could be a sign of a mental health disorder, and it's very, very important for you to go talk to your doctor as soon as possible when you start to notice the signs of a breakdown. Your doctor, they can help you treat the physical symptoms. They can also refer you to a psychologist or a psychiatrist. These mental health professionals can help you treat your emotional, mental, and behavioral symptoms. Caregivers should also contact a doctor if they're worried about a loved one's behavior or mental state. That's also a pretty big one. You should always contact a doctor if you're concerned about your loved one's mental, physical, or behavioral state. It can help them in the long run and prevent any damage later on. Now let's talk about tips for self-care. Lifestyle modifications can help you prevent a nervous breakdown. They can also help lessen the severity and frequency of them. And you can do these by getting regular exercise at least 3 times a week, which can be as simple as walking around your neighborhood for 30 minutes. If you have a dog, even better. Maybe go out longer, right? Because you have a dog, so you have to take them out maybe 2-3 times a day. That can help. The next one, going to a therapist or counseling sessions to manage stress. This one helps me a lot. I used to go to therapy at least 2 times a week, maybe 3 times. Now I haven't because of financial issues, but I'm working on that one. Avoiding drugs, alcohol, caffeine, and other substances that create stress on the body. That one's important. Try and cut down on all these, especially if you drink a lot of caffeine. Reduce your intake. Drugs and alcohol you shouldn't take, especially if you're feeling overwhelmed, you're depressed, you have suicidal ideations. These can make it worse. Getting regular sleep and sleeping for at least 6 hours a night. This is something I have to work on too. I really only sleep for 4 hours, maybe 5 hours if I'm lucky. It depends, but you should get a decent amount of sleep. 6 hours minimum, 8 hours is ideal. Try and work on a sleep schedule. Even if it means maybe taking sleeping pills, go to your doctor, talk to them, see what they say. There's things you can do to help fix your sleep patterns. Incorporating relaxation techniques like breathing into your daily routine. Reducing your stress level by pacing yourself, taking mini breaks, better organizing your environment and daily activities, and keeping a daily to-do list. Routine is pretty key when you're dealing with any mental health issue. Routines help you to keep your body in check and help you stay distracted from kind of what you're going through and use that negative energy in your body, like the negative thoughts you have, to do something productive and flush them out per se. It's important to note that you can make these changes on your own, but it also may be more helpful to come up with a treatment plan with your doctor. Remember, you're not alone. With that being said, it's okay to not be okay, and I thank everyone for tuning into this video. Take care, guys, and goodbye.